new campaign to eliminate those artery-clogging trans fats and the millions of premature deaths that they cause.
So the World Health Organization believes that removing trans fats from global food supplies would save 10 million lives over the next 5 years. That's pretty remarkable. And joining us with some perspective is our medical expert, Dr. Mandira Mehra with SSM Health. Good morning.
Good morning.
10 million lives. And I have to say, I'm somewhat of a skeptic. One of my favorite cookies from Baltimore, like back home, is filled, just chock full of trans fats. Just really terrible for you, and you know it. But are we willing to give these up? I mean, how much food are we putting in our bodies that still have these?
Yeah, so there's obviously been a push, not just in America, but also in other countries, Denmark, Britain, Canada, to really eliminate trans fats, if not really cut them down. They have a great shelf life, like you mentioned, Danica, so they're used in so many cookies and delicious treats that we really like, but unfortunately they have a long shelf life in our arteries as well, and that's really what makes them dangerous. They taste great, they have a great shelf life, and they're really cheap and affordable. So this is also a problem in many developing countries where they may not have the care to really take care of people having cardiac events, MIs, strokes, that kind of thing. And so this is really low-hanging fruit that the World Health Organization is going after by saying, let's eliminate trans fats, therefore eliminating some of those heart attacks, strokes, cardiovascular disease, diabetes, even implicated in things like women's fertility now.
Is it really that easy, though? Can we just kind of snap our fingers and say, oh, there they go? Yeah.
Great question. And so this involves policy. This involves the food industry, of course, agreeing with us, and ultimately us as consumers realizing what we're doing to our bodies. So I don't think anyone's saying don't eat the cookie, maybe don't eat the donut or the funnel cake, but we should cut out trans fats and anything kind of in that category.
I want to just shift gears now. So the big topic of conversation in my fantasy baseball league was about this Boston Red Sox pitcher, David Price, who promised he was going to give up Fortnite. He was going to give up video games because he had to miss a start because of carpal tunnel. And we laugh about this, and yet this is a very real issue that's going on with younger Americans right now who are fixated on video games.
It is, and I believe he was born in the 1980s, 1985. So anyone out there born kind of in that 80s, 90s generation or later can definitely identify with continual, almost gaming use. You know, whether it's the phone, the computer, playing, Fortnite, like he mentioned. It has properties to it that cause people to develop certain ailments, whether it's poor ergonomics, wrist issues. Carpal tunnel is very specific. It's when the median nerve in the wrist gets compressed. You can get tingling, burning symptoms, pain, even numbness in the hand, which of course for someone that's a baseball player, getting paid millions of dollars, you really need use of your hands. So he's come out and said, I don't think it's solely because of playing Fortnite, but that may be attributing to it. Many of the other players have actually spoken out and said it's not uncommon for them to play in the clubhouse, to play on the road, because it's fun and it's enjoyable, and this is what the generation does. So we have, of course, some tips for people out there. If you are a gamer, if you do play frequently, the first is take some breaks. So a lot of these players mentioned, we're competitive. This is what we do. We play sports at a very competitive level. And of course, a lot of the gamers can identify with this. They binge, they maybe have a weekend where this is all that they do. So take breaks frequently. Number two, there's splints, there's braces, there's different stretches you can use. So even if you are going to game or play Fortnite like he does, take some breaks, do some stretches. You can Google them, there's videos on YouTube, or see your favorite doctor. And thirdly, there's physical therapy, there's medications, injections, steroids, and ultimately surgery if necessary.
I'm going to be sharing this message with my 3 children as well. Moderation.
Moderation.
It's good to see you. Thank you, Dr. Mehra.
Thanks for coming in.
6:19 right now. There's new research out this morning.